live educational event called Profi Conference on May 22nd and 23rd for people living with bleeding disorders. You know, one of the things that's so important about living with a bleeding disorder today is your ability to stay consistent with your treatment regimen over a long period of time. But so often life gets in the way. It's difficult sometimes to maintain consistency. And that's one of the things that we really want to talk about. I'm passionate about helping people stay consistent in their treatment because it is what gives you the best outcome long term. Whether you're a teen or you're a young adult, or maybe you're been around for a while living with this rare disease, it's one of those things that can really mean the difference between having great mobility as you age and having limited mobility if you don't have the consistency that you need to maintain excellent treatment regimen. And so I'm excited about this event. We have some incredible sessions that we're bringing you. We're going to be talking about all kinds of things, such as pharmacokinetics and understanding where your levels are, understanding maybe some differentiation between iron deficiency, another metric that you can use from knowing that your therapy is working. We're going to be talking about prophylaxis for zero bleeds for everyone with Dr. Claudio Sandoval. I'm super excited about that session. And we're going to have a patient discussion panel talking about how really the challenges that impede things with life events, such as having kids or going to a new job. So many amazing things for us to cover in this. But one of the things that's really near and dear to my heart is the psychosocial aspect of just staying motivated. And today I've invited a good friend of mine, Lori Bienvenu, to join me to talk a little bit about a session that we're going to be doing on this very topic. Lori, it's great to see you. Thanks so much for joining me for this pre-event podcast.
Hey, Jonathan, thank you for inviting me. I'm really excited to be here and talk to you about mental health today.
Yeah, you know, one of the things that I think is so important is people have a hard time staying consistent in their treatment regimens, but it's not always just because the treatment is not sufficient. It's a lot of times just because life interrupts so much. And then there's also the disappointment factor where you thought you were going to be living a normal life and hemophilia shows its head in a weird way that you didn't expect, or you have a wedding, you have a vacation, something comes along the way and it just interrupts that progress. And so I'm really excited of all people to talk about this. You are one of the most expert people on mental health issues in general, but I know you're going to be doing a session talking about this, but what are you excited about specifically with this topic and with this whole weekend, really?
Well, I think it's really important for people to be aware we all have firsthand experience with Profi and how difficult it can be. But I think, what you just mentioned, you think about life, you think about vacation, you think about, your job, you think about your schedule, you think about, do I have all the supplies? Do I have access to medication? But I think a lot of times we don't think of the mental hurdles that come with having to adhere to Profi and having a bleeding disorder, any chronic condition, really. It's never just a physical battle. There's always a mental battle that has to be
Right.
fought as well. And so anytime that I'm able to talk to people about that, bring awareness to that, and help people work on those issues so that they can find themselves in a better place, I always get really excited about that.
I know you do, and I love that. One of the things that's really cool too is that you are not just speaking from a place of just a textbook, but you're talking about information because you live this every day. You have kids with hemophilia, you're trying to navigate this journey on your own. And I always think, for me, I've always used the analogy of like, it's hard enough for me to get my kids to brush their teeth every day. How do you stick them with a needle regularly and stay consistent through adolescence and babies and infants and all of the things that you have to do along the way? It is not for the faint of heart to try to stay consistent. And I know that that's something that's near and dear to your heart as you've kind of navigated that whole journey on your own, right?
Well, if I'm being completely honest, we don't always brush our teeth every day. I've learned that from time to time with my boys, unless I'm right there watching them. But you're right. I don't want to say that I've done this completely on my own, because certainly I have not. I've had a very large community of people behind me, and I'll talk about that a little later. But I think what's unique about our journey is that on the medical side, our journey has been fairly, I think, simple compared to other people's. And we're very blessed to be able to say that. I don't ever take for granted when I say that our journey has been easy. We had the trauma of getting diagnosed and the feeling alone and the trying to figure out how to navigate this. But as far as his treatment and his care, those things have been really easy, which have opened up the doors for me to be able to focus on the mental side of it. And that's really been my journey. That's been my greatest challenge, is accepting all of the cans and can'ts and all of
Mm,
the small milestones that come up that you have to figure out. How do I, the first time you have to, stick your child with a needle for the and you're by yourself and you don't have help, or the first time you realize you forgot to order Factor. How do you go into that panic mode and I don't have medicine to give my kid, or the first time they say, you mean I won't be able to play tackle football? It's all of those moments, going to school with a black eye and a scratched up face and being afraid that someone's going to pick on you, not having to worry about his treatment or the outcomes of that has really allowed me to focus on how do I get my kid through all of these tough moments? How do I
mm,
get myself through all of these tough moments and come out on the other side a better person and still whole? And so we hear a lot of those things from people all the time, in bits and pieces. But because I have my own, my own experience with it, it's given me, everybody's experiences have given me a bit of a different perspective. And I'm very thankful that our medical journey is easy, because I can very, honestly say that the mental part of it has not been easy. And
mm.
we've learned a lot, and I feel like we've come very far from day one, and still we have a long way to go. But
That's
don't
so
we all? I feel like we
right.
all do.
Yeah, and community, you mentioned several times, community plays a big, important role in that. You have a fantastic support system within your own family, but not everybody has that. And also you've had a lot of experience with having a great, support from other people living with hemophilia also that are just, at different seasons of life, different age groups. How has that played a role in you being able to understand, like, kind of that 360-degree view of even inspiring your own kids and helping you to navigate those challenges on your own?
Yeah, we always say at Hope, you're not alone, and that is invaluable. It's been invaluable to me, and I've really felt that so many times, and not just from people at Hope, people that I've met out in the community, people that are just, our family and friends, that because I'm educated on these things and um, I know what to look for, and I know the research, and I know, the ins and outs of it. It's very easy for me to have those conversations with people. And so even people in our community that are not part of the bleeding disorders community, I feel like a lot of them are very educated on these things.
Mm,
But because of that, they've been able to be a tremendous support for us.
that's so
Um,
good.
but community is so very important for a lot of reasons. When I think one of the biggest hurdles that people face with, um, any chronic condition is sort of this, fear of not being in control, um, and
Mm,
and losing things. And we kind of do. It's easy to harp on those things, the things that you can't do, the things that you can't control. They tend to take front stage, and they shouldn't.
mm,
But
mm,
those are our burdens. And so for us to just say, I'm not going to focus on that, I'm going to focus on something else, that's really, really hard. But it's a
mm.
lot easier to do that when you have a community of people who are guiding you, and also a community of people who can provide, or a community in general, that can provide opportunities to overcome those things.
Yeah.
So, you know,
So good.
did I cut you off?
No, it's so good. I was
Okay.
giving you an amen. That's great.
Okay. Thank you. Um, But there really is, there's so much about bleeding disorders that's not in our control. I mean, we for the most part, we can choose our doctors, although I've heard people say that they had no choice and there's one doctor on their plan and that's who they have to see.
Mhm, mm,
We can't always choose our pharmacy. Some doctors don't give us the freedom to choose our medication. We can't always, choose. There's a lot of things we can't choose. Um, but that's not really where we don't want to stay in that space. I don't want to stay in that space, because for me to be in that space is heavy, and that's where
mm,
you do start to feel alone. You don't feel empowered there. You don't feel supported there. You feel like you're stuck.
mm.
But if you have a supportive community behind you, you can get past those things. One of the things for me is, I'll give you an example. Matt is my son with hemophilia. Matt's prophy. A lot of times I feel like I just don't want to do this. It's time consuming. It's burdensome. And, at the end of the day, I know it's good for him, and I can tell myself 100 times, he needs this. He can live the normal life that he's living right now because of this. But that's not the thing that's going to motivate me at the end of the day. The thing that's going to motivate me is the guilt that overcomes me by knowing that I didn't do his prophy. It's,
Mm.
or it's so many other things. It's not the things that are right here in the present. And I really had to learn to really change my perspective on that, to embrace I get to do this rather than I have to do this.
That's so good. I think, we're talking a lot about how there's so many people around the world that don't have access to treatment at all. And the fact that we even have that access is really a great reminder that we need to take advantage of it as much as we can. And this is really what you're going to be addressing in your topic about how to stay motivated. I love your title because it's staying motivated. Yes, you can. It's there is an aspect to it. Is I think that we get deflated and disappointed. We get tired. I get tired. I don't want to infuse when I'm supposed to. Honestly, it's my wife and my kids and my family that have jumped in and kind of helped me to see it. But when I see patients out there and other people in the community that are living their best life, I kind of want to live that too. So it
Yeah.
makes me lean into that. And so I'm really excited about your presentation on motivation in general, because it is something that I think we all need motivation during difficult times, right?
Absolutely. And where you get that motivation is such a critical piece. It's not just having it, because at some point you might be motivated right now. It's easy to be motivated when everything's going great. But how do you get motivated when things are terrible?
Right.
Or even, for some people, it might not even be terrible. It just might not be that great.
Right.
And maybe it's not even that great. It's just even keel. How do you stay motivated in those moments? Um,
Mhm.
we talk so much about community and the importance of it. And, when I think about how the community formed so many years ago, it really did form around this horrible experience for so many people. And in those moments, it's easy to see why you need other people, and it's easy to come together. It's people bond over traumas. Um,
Mhm.
and so it makes sense that we had this wonderful community that formed. And now that we're not quite in that same moment, it sort of feels like there is a bit of a breaking down in the community. But
Mhm.
that really shouldn't be the case, because it is a different challenge. The challenges of today are not the same as the challenges of the past, but they're very much still there. And,
Mhm.
every woman who's fighting for a diagnosis right now will tell you that.
Mhm.
Every patient who's fighting a PBM right now or copay assistance will tell you that. Um,
Mhm.
the issues are different, but there's still issues that need to be overcome. And it takes a community to fight against them. It also takes a community to empower you to find your voice in those moments. So, maybe you can't choose your medication. Maybe you can't choose your pharmacy. Maybe you can't play sports. There's a lot of can'ts here, but you can educate people on those things. You can use your voice to advocate. Maybe your story is the story that gets in front of the right politician, that strikes a chord in his heart and encourages him to file a bill. And you never know. But there are so many other things that you can do that might not fit right within that square box that we have, but it can still be empowering, and it can still be a change agent if you learn to recognize that those things are important. But you can't do any of those things without community. One voice is not going to make a difference, but an entire community of people speaking up absolutely can make a difference.
That's so good, Lori. I love that. And I know that, one of the things that I love about the sessions that you do specifically are always kind of geared towards giving us tools to walk away with, to remind ourselves how to engage, whether it's, we've talked a lot about mental health and, asking questions. We've talked about caring for the caregiver. We've talked about, I love your calm presentations are always so, brilliant around active listening and, all of these tools that we need to be able to engage our mind and our heart and stay connected. Because I think sometimes when you have a point of pain in your life, there is a tendency for all of us to want to separate ourselves from that pain. And we want to just do anything we can to ignore it. And I've seen people do all kinds of crazy things. I mean, we used to talk about oftentimes in the treatment centers how there was this teen rebellion that everybody would go through where they would reject the medication and not want to take the medication. But all of these seasons of life are really, really, I think these are the things where if you can stay connected in a place that you really, like you said, none of us really want this, but we find ourselves here, and the issues are, how do we stay in a place where we can, motivate ourselves internally, but also community plays a huge role in that motivation. I might not feel it internally, but I can look at the people around me. I can look at my support system. I can look at those other people actually maybe that I don't know, but I've seen out there in the community, the broader community, that can help me, to inspire me to keep going and doing better for myself and for the people around me too, because you're not just being inspired by them, but you're also leading someone else that you might be inspiring you never even realized you were inspiring, that doesn't even have a bleeding disorder. So all of these things are so critical, and I'm excited about this session. I'll just put it out there for you. How can people register for this event? How do they find out about it? How do they get the links for your session? How do they connect to this?
Yeah, absolutely. If you go to our website, hopeforhemophilia.org, or hope-charities.org, you can go to the events page and register for our Profi conference right there, and you'll get an email. You can sign up for text messages, and you'll get all of the links. This session is on Thursday afternoon at 1 o'clock, I believe.
Yeah.
So yeah, I'm looking forward to seeing everyone. Please come with your questions. I always like for these sessions to be interactive, so I will probably talk a lot less than I did today. So I'll be asking you for some of these answers, which, just brings a smile to my face.
That's so wonderful. I love it. Well, we always love seeing your smiling face. I appreciate what you do, not just in these moments, but every day at Hope. You are just a treasure and a blessing to our community in every way, and to me personally. And so, thank you for taking the time to be a part of this pre-event podcast, to talk a little bit about this session. And we look forward to seeing you in your session very, very soon. Thanks so much.
Thank you.
All right. Well, with that, please make certain that you take time to go and register right now. If you have not already, go register at hope-charities.org, or as Lori said, hopeforhemophilia.org. Either way, it'll take you to the same place. You can register right there. You'll see the link right down on the homepage, or you can use this little QR code up here and click on that, and it'll take you to the link as well. But we really hope to see you there. I want to say a big thank you to Lori for all of her hard work on this session for mental health issues, as we strive to really do a better job at trying to understand how to stay motivated and how to stay consistent, because what good is the great things that we have available to us if we don't use them and utilize them the way that we should? So let's be that community. Let's be that support system. I'm looking forward to meeting you there and hearing more of your story and understanding what the challenges and struggles that you might be facing. We're going to have a ton of fun together too. We always love generosity, so we're giving away gifts and prizes, and there's a lot of fun that we'll be doing together, and we'll get to meet people from all over the country. We generally see hundreds of people come out to these events online. You can join us from your tablet, from your phone, from your computer. You can join anywhere, and we would love to see you there. So go to the website, register right now for this wonderful event. It's going to be live. You can ask questions to Lori and many of the other speakers on the other topics that we have going on. All you have to do is register once. You get all the links, all the information will come straight to your inbox, and you can join us straight from there. But once again, big thank you to Lori. And also, we want to thank our event sponsor, Octapharma, for helping to facilitate a way for us to be able to bring this education straight to you where you live. So we couldn't do it without their support. Big thank you to them as well. So we look forward to seeing you now. Go ahead and register immediately. We'll see you